reports on time. Okay. Now coming to the criteria for reporting. So any serious and unexpected event that is related by investigator that has to be submitted to both Europe and FDA, EMA and FDA. So there is a change in this slide and try to focus on this. Previously, from March 23, it was mentioned that for Europe, if the causality is related by investigator, then they have to submit. When we are submitting the case for FDA, in that case, if that causality is related by both investigator and marketing authorization holder, then only we have to send to FDA. But there is a recent change from 2023. This is not in this slide, so try to focus what I am trying to say. If there is any serious unexpected adverse drug reaction that is related by investigator, irrespective of marketing authorization holder, that is sponsors causality, we have to submit to both Europe and FDA. That is the recent change. So I'll repeat again. Any serious and unexpected adverse drug reaction that is related by investigator, it has to be submitted both to EU and FDA, irrespective of sponsors causality. So most of the students go wrong in this guidelines because they used to follow the older versions. So keep this change in your mind and try to answer in interviews if it is asked. Next, coming to the timelines for reporting. So any serious, fatal, life-threatening event that has to be submitted within 7 calendar days from IRD. IRD is initial receive date. That is when the pharmacovigilance professional, whoever is in first contact is aware, that is the day 1 of that case. So IRD stands for initial receive date. So any serious, fatal, life-threatening event that has to be sent within 7 calendar days. Any serious, non-fatal, non-life-threatening events that fulfill the criteria of hospitalization or prolonged disability or lead to any congenital anomalies or IMEs, important medical events, those things should be submitted within 15 calendar days from clock start date. This clock start date or initial receive date, both are same. Okay. Sometimes students will confuse with central receive date. Central receive date means when the pharmacovigilance team is aware of this adverse event. Okay. So you should not confuse with that. So IRDs and CSTs both are same. Initial receive date and clock start date. These are the time on which the first point of contact pharmacovigilance professional is aware of this serious event. From that, within 7 calendar days, all serious, fatal, life-threatening events should be submitted to the regulatory authorities. And serious, non-fatal, non-life-threatening events that have the criteria of hospitalization or prolonged disability or which has important medical events and congenital anomalies, all those things should be submitted within 15 calendar days. Okay. Now coming to few exceptions. Okay. So this rule is not hard fast, but there are 3 scenarios where if you find any serious events that has to be submitted in an expedited manner. For example, for EMA, if you find any lack of efficacy cases with life-threatening diseases or vaccines or contraceptives, you have to submit within 3 calendar days. We call that as emerging safety issues. Okay. So there are few scenarios which I am going to discuss. In these situations, you have to submit within in an expedited manner. Say for examples that any observations that can change the benefit risk evaluation, such as safety findings from non-clinical, clinical and epi studies, genicity terms. Okay. So this has to be submitted in an expedited manner. So what does this means?